Hey everybody, Dr. Diane here. In this video, we're going to talk about Alzheimer's, dementia. We're going to talk about some of the root causes, and we're going to talk about some of the challenges that are existing with lab testing and that sort of thing. So, Alzheimer's is obviously a progressive neurological disease, and there's not a lot that can be done right at this point other than palliative care. There's some level of really exciting treatments that are being studied right now, such as that sound therapy and light therapy, that have been shown to really start reducing some of the process and the progression and maybe even reversing Alzheimer's. But those sort of things are still being trialed right now. So right now, where we're best at with Alzheimer's is preventing it from happening. What we see is typically if people start showing signs of being demented, they start showing on what's called the mini mental status exam, where people do testing to see if they have cognitive problems, if they are suffering from memory loss and these sorts of things. Typically, most people are given like this watch and wait type of criteria, where it's basically wait until it's bad enough. Well, that's not a really good plan, right? Because typically things like Alzheimer's does progress. So then we have to take a step back and say, well, why is this happening to begin with? So if you are somebody that is suffering from memory loss, if it's just small memory loss or large memory loss, especially if you've been given any sort of watch and wait diagnosis, but hopefully even before then I hope you're taking this information seriously. So there's a couple things I want you to know. One is that Alzheimer's has been also called type 3 diabetes. It's been called type 3 diabetes because now we're seeing that part of the process of plaques in the brain, which are associated with Alzheimer's, might actually have something to do with the way the body is responding once glucose gets into the brain. And the brain actually being resistant to the glucose, to the sugar that's in there, creating problems. So we want to make sure that you are looking for signs of high blood sugar. Now, frequently we see that the most common lab that's not being tested for blood sugar is insulin. Oftentimes people get glucose tested or hemoglobin A1C. But insulin oftentimes is an earlier marker of blood sugar imbalances and can sometimes be a better marker for showing what's going on inside the brain. So we want to really consider that insulin level when you're testing. Another thing to consider is there's some level of evidence and research that Alzheimer's actually, or that plaques that are associated with the process of Alzheimer's actually have a level of anti-inflammatory and immunological process with them. So what can happen, for example, is that we can get plaques in the brain because the immune system's trying to do something. We're trying to trap toxins, we're trying to trap infections, right? And trying to trap toxins, infections, something goes haywire, and all of a sudden there's a problem. So what can we do about that? Well, we can figure out what's going on with the brain, where there's toxins there, where there's infections there. So these could be infections of a wide variety of different types, toxins of a wide variety of different types. But you can run tests like the Total Tox by Vibrant Wellness. You can run tests like that. You can run tests such as tick-borne test. So if you're interested in stuff like that, please see the information about my clinic and how I work with people below in the show notes. And if this is helpful, if you know other people with Alzheimer's or with dementia, or people that are even just saying they have brain fog or memory loss, I would definitely encourage you to send this along. So then we want to make sure that people, if they're being told watch and wait, that they're actually doing things now, right? Because there are processes early on when it comes to dementia before too much damage has been done. There are things that can be done sometimes to fix and reverse the process. The problem is once that somebody gets to Alzheimer's, there's just not much that can be done at this point in science, right? It's still worth trying. I'm still seeing things where sometimes we're slowing down the process, but there's really a lot more that we need to do in research to really help people with these types of diseases. So the best medicine for Alzheimer's and for dementia really is in taking it seriously when there's a level of cognitive memory loss and there's a level of change, and starting to get to those root causes early on so the brain has time to heal before it progresses to that sort of scenario. So hopefully this has been helpful. If you like this, please subscribe, and I'll see you in the next one.